Hello, my name is Lauren Brotherton, and this is my skill video for my HOSA clinical specialty project. Today I will be demonstrating a basic head, eyes, ears, nose, and throat exam, or a HEAT exam, which is part of a general head-to-toe workup in a primary care visit. So, to begin the HEAT exam process, we gather our desired materials, which today I will be demonstrating the exam on myself, this foam mannequin head, and I will be using some instruments that I have, which is a small handheld otoscope and a tongue depressor and lights and stuff like that. So the exam usually starts off at the head, which starts off with a basic head palpation exam, looking for specific areas of pain and any irregularities in the hair or scalp texture. Next, you can observe the symmetry of the face and the symmetry of the eyes, especially, making sure that things can move and react equally. This is also a time where the physician may perform nerve tests on the patient, gently tapping on the forehead and cheeks, asking if the sensations feel the same, and also asking the patients to open and close their eyes, show their teeth, and fill their cheeks as such, to make sure that facial nerve function is equal. So, next, you move on to the visual field tests, which is part of the eye exam. So, the physician may test the visual fields by having one of the patient's eyes covered and looking straight ahead. They may use a pen, or they can hold up numbers on their fingers and move them slowly into the patient's peripheral vision, asking when the patient can see them and how many numbers that they may see at a time. Visual acuity may also be tested by an eye chart test, which happens when a patient stands at a distance from an eye chart and covers one eye. Obviously, they will do both, but they cover one eye and they are asked to read the smallest line of numbers and letters that they can. So, next, as part of the eye exam, is noting the position and symmetry of both eyes and eyelids. Obviously, on a mannequin head, such as this one, symmetry of the face and eyelids will be perfect, and on most humans, there is a small bit of asymmetry, which is normal, but in general, we are looking for facial reactivity symmetry, which is my way of explaining how the facial nerves are properly interacting with each other and making sure that the face moves and behaves the same on both sides. So, you also observe the eyelid color, which you can observe the sclera color and the inner eyelid color. So, next, you can observe the conjunctiva of the eye, which is the outer membrane, making sure that there are no visible texture or color abnormalities. So, a pen light may also be used to check the shape and reactivity of both pupils on the patient. And you can also observe extraocular movements of the patient by having the patient follow your finger or a pen with their eyes. And also doing a test where you tell a patient to fixate their vision on one object, which can be finger, pen, or your eye. At this point, the physician will use an ophthalmoscope to check the ocular fundi of the eyes, making sure that the color and the the optic disc is pink. There are sharp margins and normal vasculature of the fundi, meaning that there's an adequate number of red blood vessels in the pink tissue. So next we will move on to the ear exam, which unfortunately my mannequin does not have any ears, but thankfully I do. So to start the ear exam, the physician will examine the outer part and structure of the ear, looking for any abnormalities in the skin or abnormal discharge coming from the ear. Using, for the inner ear examination, an otoscope will be used, which is an instrument that offers 10 times magnification and light for ear and nose exams. So a physician will gently stretch the outer part of the ear and insert the otoscope, looking at the canal, eardrum, looking at the canals, eardrums, and auricles of the ear. The canals should have some hair and no swelling or redness, and a small amount of wax. Drums should be a pinkish gray color in a neutral position and mobile with air inflation. You can also check auditory acuity at this point by asking a patient if sound is equal on both sides. Moving on to the nose and sinus exam, you can begin by observing the structure and skin on the nose. You can palpate gently to check for tenderness areas of the nose, and also a palpation examination will happen for the sinuses as well, checking for extreme areas of pain and tenderness. So, using a different tip for your otoscope, you can perform the nose exam. Some physicians may elect to also use a nasal speculum and a pen light, but I have found that most use an otoscope as well. So a patient will lean the head back and the otoscope will be gently inserted into the nose, observing the septum, mucosa, and turbinates of the nose. So your septum should be centered, which typically nose symmetry is not always perfect, but it can be close, and that is what we are looking for. So you should also be looking for the turbinates projecting to the nasal passages, making sure that air is free flowing, and there should be a normal amount of mucus, and the mucous membrane should be a healthy red color. Moving on to the throat and mouth exam, a tongue depressor and light will be used. So the mouth exam actually starts on the very outside of the mouth, looking at the lips, making sure that the skin on the outside is free of any lacerations, sores, or irritation, and the lips are symmetrical and of a healthy color. The inner part of the lips will also be examined, where where the tissue should also be a healthy pinkish color. A light can also be used to examine the hard and soft palate of the patient. The patient will gently tilt their head back and open their mouth, where the physician can shine the light and examine the palates. So your palate is the hard part of the mouth right above your tongue, and also the soft part where your uvula hangs towards the back of the throat. So, next, there will, The hard palate should be whitish in color, firm texture, and have irregular ridging. The soft palate should be pink, moist, and should move upwardly with the sound that many physicians will ask you to make. So, also part of the oral exam is the tongue exam. The tongue can be depressed for this part, and it should be pink, moist, and slightly rough on the dorsal side, which is the top side of the tongue, and smooth, pink, and glistening on the other sides. Also, while depressing the tongue and having the tongue stuck out, you can use the light and ask the patient to say ah, which will bring the soft palate up, and the tonsils will be visible. If the tonsils are present, they should be pink, symmetrical, and normal size with no lesions or pustules. Healthy cheek and oral mucosa tissue will be pulled back and inspected, looking for pink, moist, and smooth tissue. For the teeth and gum test, teeth and gums will be lightly inspected for healthy tissue and white, hard enamel on the teeth. The pharynx test is used with a light and tongue depressor to observe the pharynx. The patient will be asked to say ah to show the pharynx, and the pharynx should be symmetrical, normally sized, and pink. The mouth, nose, eyes, and head should be free of any abnormal lesions, sores, pustules, abscesses, or any clues pointing to infection. This exam, while it seems basic and rather long and annoying, is actually one of the most important parts of a general visit exam, and it can tell many underlying clues and symptoms to many diseases that people may not even know that they have.